Hey, BC here for BC Nephro. Thanks for watching. Today I'm going to talk about kidney cysts, and I'm going to give you my framework for how I think about kidney cysts and my approach for further evaluation. So first of all, kidney cysts are very common. They're the most common renal lesion found. They're more common in males than females, and they're more common with age. So if you're talking about people in their 70s, patients in their 70s, up to a third or more of patients will have at least one kidney cyst. Most of them end up being benign, but we need to figure out, make sure there's not something bad going on, so we can be able to reassure the patients who have a benign condition and either monitor or further work up patients that could have a more severe condition. What is a more severe condition? What could be bad? Well, the first thing is a cystic kidney disease that can lead to progressive kidney disease or kidney failure. Kidney failure is bad. The second is a cancerous lesion. Cancer is bad. So here's how I think about it. First, you get the imaging, either an ultrasound or CT, and it's either a cyst or a mass or indeterminate. Now, if it's a mass, it could be cancerous, so you need to evaluate this. And really, the way to evaluate this is with a contrast study, a CT urogram or an MR with contrast. If it enhances, it could be cancer. If it does not enhance, it's most likely not cancerous and benign. If it's indeterminate, it's usually indeterminate because it's too small, less than a centimeter. These lesions are most likely benign and most likely cysts, but it's reasonable to follow these with a surveillance imaging, maybe an ultrasound a year later. I find that ultrasound is often better than CT for distinguishing a cyst with liquid component from a mass. Okay, so we have a cyst. Now we want to make sure there's not a cystic kidney disease that can lead to progressive chronic kidney disease or kidney failure. The most common of this is going to be autosomal dominant polycystic kidney disease. There's other rarer ones that I'll have listed in an article at bcnephro.com. Link will be in the description below. So let's think about autosomal dominant polycystic kidney disease. How do we figure out this is not going on? Well, first, it's an autosomal dominant condition, so you want to know a family history. Most are going to have a positive family history, and even if there's just a few cysts, especially in a young person with a family history, you have to be concerned. They most likely have this diagnosis. You're not going to have a positive family history in all cases of polycystic kidney disease. Some cases you may not know the family history. Some cases there may be a de novo mutation, so you're still concerned about this. It turns out that multiple bilateral cysts are less common in patients under 50. So if you have a patient under the age of 50 with multiple bilateral cysts, you may need to further evaluate and stratify for some sort of cystic kidney disease. The third thing about polycystic kidney disease is it causes kidney failure essentially because the parenchyma of the kidneys is replaced by cysts. The cysts tend to be large and expand, and the kidneys tend to be enlarged. So if you're seeing enlarged kidneys with multiple cysts replacing a lot of the parenchyma, you're more likely to be thinking about polycystic kidney disease as opposed to normal or smaller sized kidneys with a few cysts and a lot of retained parenchyma. There is genetic testing that can be done for cases that it's not clear or there's not a family history. The other more rare cases of cystic kidney disease will be in the article, and if there's any concerns about maybe other signs of kidney disease, decreased GFR, multiple bilateral cysts, especially in a younger patient. The next thing when thinking about kidney cysts is to make sure that it's not cancer. So how are we going to do this? The first thing is to find out if the cyst is simple or complex. If it's simple, it is benign, does not need to be followed. A simple cyst is a cyst with a thin wall containing fluid only, no internal debris, no internal septa or things like this. A complex cyst could be cancerous, and there's different levels of complexity. In order to assess this, there's a Bosniak classification to help triage the degree of complexity of the cyst. So simple cyst is classified as Bosniak 1. A moderately complex cyst is classified as Bosniak 2. And Bosniak 2 is most likely benign. Bosniak 2 is divided into 2 and 2F. Bosniak 2 is benign and technically does not need to be followed, although we often do a surveillance ultrasound at 6 to 12 months to make sure, but generally that's fine. Bosniak 2F, you don't know for sure that it's benign, So that typically is followed for a 5-year period, first at 6 months and then yearly for 5 years total to ensure benign. Now, if you're getting into Bosniak 3, this is more complex and there's more of a concern for this being a cystic neoplasm. There may be a 40 to 60% chance of these being malignant, and other non-malignant things may be a hemorrhagic or an infected cyst. Bosniak 4 has a solid component to it often, and this is most likely malignant, 85 to 100% chance of being malignant. So the next thing you do, if you have a complex cyst that's a Bosniak 3 or 4, you're going to want to do a contrast study like you would do for the mass and see if it enhances or not. Bosniak 3 and 4 lesions are going to enhance, and you're concerned for malignancy there. Bosniak 1 and 2 do not enhance. Bosniak 2F maybe has a subjective enhancement that is hard to tell, but these are followed. This is the approach for management for kidney cysts. First of all, is it a cyst or a mass or indeterminate? Second, if it's a cyst, is there some sort of cystic kidney disease? You're looking at family history. You're looking at multiple bilateral cysts in a young patient. You're looking for enlarged kidneys. You're looking for other signs of kidney disease. If this is the case, you're looking to refer to nephrology. If this is not the case, you're looking for, is it a simple or complex cyst? If it's a complex cyst, you're looking if it's more complex or with solid components, and then in that case, you're looking to do a contrast study to see if it enhances, and you're looking to refer to urology for management. So that's it. Kidney cysts, thanks for watching. If you have any questions or comments, ideas for future topics, leave them in the comment section below or email me at brian@bcnephro.com. If you made it to the end of the video, thanks for watching. Hit like, subscribe, let your friends know, and until next time.